again, this is Ricky Gonzalez. I'm your financial advisor and your senior community advisor, meaning that I work with all the seniors, typically over 65, turning 65, going into Medicare, out of retirement. What are your options? What you need to do? I can talk to you and help you about with all the major carriers. So I can do MedSubs, I can help you with Medicare Advantage. I can help you understand your retirement options, meaning your 401k. What are your options in regards to making sure that money lasts forever? I can also help you with cancer, ancillary products like hospital indemnity. There's a whole bunch of things that I can help you with, but that will come in more different episodes. I'm going to talk today just about basics of Medicare. So if you don't know about how Medicare works, I will give you a quick 5 to 10 minute presentation on Medicare, very simply explained. As you know, the first thing that you should need to know is that you qualify for Medicare based on your age. When you turn 65, you get your Part A if you have worked 40 quarters or 10 years in the United States. Also, if you have ESRD or end-stage renal disease, and or if you are disabled for more than 24 months, receiving Social Security disability income. Those are the ways that you can get into Medicare. Now, most of the people will do get Medicare, and when they turn 65, that's when you receive your Part A, red, white, and blue card. Then you will have a decision. If you are an employee that has employer coverage, you could stay on your current plan with your employer, but there are some pitfalls, some pros and cons that the only way that we could do and check if that works, it's by having a one-on-one with you and understanding what your options are. And I'll tell you real quick on an overview on why I say that is because some employer coverage, or most of them, you have to pay some out of pocket for your premium. Probably your wife or some dependent could be or not in it. Also, there's a deductible that you have to meet before any benefits begin. And then you have co-insurance. Sometimes it's 70, 30, 80, 20, depending on your policy. As well as you have co-payments for your doctors, specialists, and primary care. And then you have different type of co-insurance regarding the different type of medical needs that you have. Now, so let's just dive into what Medicare is and how does it work. In a very simple explanation, the Medicare booklet, as you know, is this thick, and you have to go through it if you want to, and you should before you sit down with any agent. But more importantly is how does it work. So let's just start with Part A. Everybody gets Part A whether they ask for it or not when they turn 65. That's why if you have employer coverage, you're gonna still receive your Part A that says hospital, and then it's gonna have the blank space for where it says Part B. If you are already taking Social Security benefits, then you're gonna receive Part A and B at your age of 65, whether you ask for it or not. It's gonna come automatically, so you don't have to worry about it. So let's talk about Part A. Part A is called hospital insurance. Hospital insurance does not have a premium because you have been paying into Medicare for all your life. As you've been working, you have been paying into the Medicare premium, thus you get Part A without a cost. Part A covers hospitalization. So between days 1 and 60, it could be 1, 3, 4, 5 days, 6 days, up to 60 days. In year 2020, you're gonna have a benefit deductible of $1,408. So if you stay 1 day or 2 days, you have to come up with the first $1,408. And again, just to reiterate, what I'm going to talk about is original Medicare in and of itself. I'm not going to touch today any subjects about Medigaps or Medicare Advantage. How do we fix these gaps or deductibles? I'm not going to talk about that today, but let's just talk about Medicare. So we continue. From day 61 to day 90, if you have to stay longer than 60 days in a current period, meaning you you got sick, your day 60 comes over, you have to now stay 61, 62, 63 days. From day 61 to day 90, you're gonna have to pay a copayment per diem of $352. So it starts getting expensive, as you see. Now, God forbid you are really ill and now you have to stay at the hospital over 90 days. Your copayment per diem from days 91 through 150 is gonna be $704. Now imagine you having to pay $704 a day. So let's take the example of you getting into a coma or going into ICU. That's gonna be a big check that you're gonna have to come out of pocket. So that's why you need to find out a way to cover those needs, and we will go into that later. Now, there's some skilled nursing facility also is covered until Part A. It's also called rehab. Basically, the first 20 days, Medicare pays for all. So, skilled nursing facility, you don't have to pay for the first 20 days, but you do have a copayment of $176 per day from days 21 through 100, and that's gonna come out of your pocket. 100 is the maximum limit that Medicare will pay. You're gonna pay between days 21 and 100, and then after days 100, it's all on you, 100%. So that's basically it. You also have custodial care, home health care, assisted living, hospice, some blood pumpings and whatnot, but that's a list of your worries. Your worry is about hospitalization. So think about it this way. If you are not hospitalized, it's not Part A. If you are in the hospital and for more than a day, now Part A is the one that you have to worry about. So now let's talk real quick about Part B. This is what you have heard around the 80-20, or do I pay 20% and Medicare pays 80? Well, let me explain you how that works. Basically, first of all, and most important, in 2020, there's a premium for the people that make under $85,000 on your tax return. You have to pay $144.60 a month, and that's gonna either come out of your Social Security check, or if you decide to not pull the trigger on Social Security at age 65, you will then have to pay that quarterly to the Social Security, to Medicare. So you have to send them a check of $144.60 times 3. You make the math that you have to pay in advance. Now, so how does it work? Basically, Medicare will pay for 80%. First of all, you have a deductible. That deductible is an annual deductible of $198. That's simple to understand. You are the first $198 you are responsible for. Now, once you meet that $198, after that annual deductible, from there on out, you will pay 20% of all medical expenses. That's why Part B, when you look at your red, white, and blue card, says medical, because everything else that is not a hospitalization will fall typically under Part B. So how does that work? Let me give you an example. Medicare pays 80%, you pay 20%. So let's say that you have to go to a cardiologist, and that cardiologist visit is typically $500, and this is your first visit of the year. What's gonna happen is that you're gonna have to pay the first $198 out of pocket so that you meet your deductible. Once that deductible is met, then you are now paying 20%. So $500 less $200, just to make a simple math, we're looking now at $300. At 20%, that's $60. So that visit to your cardiologist is gonna be around $250. Now, from there on out, everything else is 20%. So let's say that doctor tells you, all right, Mrs. Jones, come back in January, come back in February and do an MRI, because I want to see what's going on your heart, and that MRI is gonna cost $10,000. Well, guess what? Your out of pocket is gonna be $2,000. Now that same doctor, now it tells you to come back again on March to read the MRI results and tell you if you did well or not. And what's gonna happen is that visit, because you already had made your deductible of 198, now you only pay 20%. So that $500 visit now becomes a $100 visit. So that's basically what Part B works, and that works for doctors, that works for your durable medical equipment, that works for everything else that is not hospitalization, lab work, everything else that has nothing to do with being on the hospital. Now, the third part that is extremely important is that you must pick a Part D. A Part D is your prescription plan. You have to have at least a minimum plan that will cover and satisfy Medicare guidelines for Part D or prescription drugs. Now, if you take only generics or you don't take any prescriptions at all, then just basically pick up the cheapest plan on the market just to satisfy that Medicare Part D requirement. If you don't do that, then you will incur in a late enrollment penalty down the road. So let's say that you're healthy and you say, hey, I don't need a Part D. It's your choice. You don't have to buy a Part D now. But say 5 years from now, you do become ill, what's gonna happen? Yes, you're gonna get assessed with a penalty for the rest of your life. So that $13.20 premium that you're gonna be paying now for the lowest premium out there in the market, which is, I don't wanna mention carriers now, but that's the price for the lowest carrier right now, $13.20 in 2020. If you were to wait until 2030, what's gonna happen? Now you're not gonna be paying $13.20 with the assessment and the penalty. You might be paying, I don't know, $18, $19. So don't take the chance. You might develop any conditions during the year, and you only have one chance to enroll, and that's during your open enrollment. So I hope you understand this video. If not, I will come back again. I want to break everything down because I need to talk to you about what is it that I do. Again, Medicare Advantage, Medicare Supplemental Plans, final expense, ancillary products like cancer, heart, stroke, hospital indemnity, I said my final expense already, right? So I say it again. Ordinary life insurance like Universal Life, Whole Life, Fixed Index Universal. I also do retirement planning with annuities. So there's a lot of things that I can help you with. I hope you like this podcast or blog or YouTube video. I know that I'm blabbering all over, but you know what? I'm learning and I'm doing it, and I'm going to do it with you. I've been doing this for 20 years, so that I can tell you. I work with all the major carriers. I know what I'm doing. I have no agenda, but other than to help you understand your particular options. So, thank you for watching. Hit subscribe. I'll keep you posted of everything. God bless. See ya. Bye.